Hi guys, my name is Callum and in this vlog we're going to be looking at skill and capacity factors influencing acceleration and change direction. So to overview this vlog, we'll be covering skill and capacity factors influencing performance in both the 40 metre acceleration and the 10 metre multiple change direction. Some of these factors will be summarised by placing them into three categories: skill factors, capacity factors, and those that I feel are influenced by both, which an assessor should decide whether they sit more on the side of skill or capacity factor. From here, I will identify a primary flaw in the two athletes' acceleration and a primary flaw in change direction ability, suggest what is the cause of the flaw using assessment exercises, and state potential ways to turn the flaw into a strength. This will be done first for acceleration for athlete 1 and 2, then for change direction. So skill and capacity factors, acceleration and change direction as follows: on the left, on the right, capacity, and then those influenced by both are in the middle. In the case of this vlog though, I feel that most of them are shifted over to the left, and that is determined from the assessment. So looking at athlete 1's acceleration, I'd suggest the primary flaw to be the rather slow or weak triple extension, suggesting quite a slow rate of force production or a limited rate of force production. And we can see this in a few different ways. So to begin with, the stride length over the 3 seconds is 12 as a comparison to 14 for the other athlete, and also the stride rate is the stride length is a little bit shorter than the other athlete, athlete 2, even though they have very similar anthropometrics. We can also see here that there's a little bit of a heel strike happening, and again potentially that's because the athlete is trying to spend more time on the floor to produce enough force to go at the speed he wants to, and that is leading to the slow rate of force production. That also could be because of limited tissue elasticity as well. And we can just see the athlete is struggling to really get that nice extension, that nice snappy extension from the back leg, from the hip extensors, knee extensors, to propel himself forwards and produce a quick acceleration, rapid acceleration. And now for athlete 2, the primary flaw presents itself from the side angle. So we'll just bring it to slow-mo when we come to there. So what we can see here from the athlete is quite excessive hip external rotation, and I feel this is also leading to quite excessive torso and shoulder sway and rotation. So if we pause the video here, we can see quite clearly from the athlete here that this knee on the left hand side is facing outwards, the foot also facing outwards, and we can also see the back of the right leg, the lower portion of the right leg trailing on the inside as well. Okay, so to combine that, we also see quite an excessive amount of torso motion. I think that potentially is a compensation made from the athlete. And this is likely due to the athlete's movement history of playing football, where they're receiving the ball on the inside of the foot, and also going to be cutting inside, outside quite a lot, as opposed to running in straight lines during the acceleration. So to round up for acceleration, athlete 1 has a stride rate of 12 over the first 3 seconds. The primary flaw is slow/weak triple extension. The factors influencing it are rate of force production, muscle fiber type, intermuscular control, tissue elasticity. I feel this is displayed as the slow/weak triple extension, and this causes slow rate of force production during ground contact time, which then causes a lower stride rate, shorter stride distance, and potentially some excessive heel strike, as we saw. To assess this, we looked at hip flexion and extension range of motion, which was okay. We looked at acceleration derivatives with some cueing, and then we looked at broad jumps and explosive hip extension tasks. For athlete 2, he had a stride rate of 14 over the first 3 seconds. The primary flaw was the excessive hip external rotation, which we saw from the front. The factor influencing this was the limb placement control / technique from movement history, such as playing football. This was displayed as hip external rotation, and this caused the force to be expressed laterally, not horizontally, causing the trunk / shoulder rotation and the sway to compensate, resulting in loss of proximal stiffness in the trunk, and thus loss of vertical and horizontal force produced from the arm drive. To assess, we looked at hip flexion and extension, asked if we can be achieved without rotation, and it could. So we then moved on to looking at ABC drills to see if the athlete could achieve this without rotation, then the wall leg drive drill to see if the athlete could achieve this without rotation, and we could also look at prowess/resistance sprint work. In terms of programming, we could look at some hip abductor and internal rotation pre-activation work with maybe a resistance band or a glute band, doing this before sprinting to see if he's able to maintain, with more pre-activation in their muscles, maintain more aligned sprint technique in the hips. Now let's look at change direction for athlete 1. So we can see very easily, I think the primary flaw is the athlete is not able to stay in a relatively straight line. As he changes direction, he drifts quite far off to the side, which is meaning that there's a longer distance for him to cover, and the force is not being expressed in that straight line, it's being expressed laterally. So if we just bring him back round, what we can see is the potential reason why this is occurring is due to when the athlete goes to turn, he's not really hinging his hips back. So as he comes to here, he's not really hinging his hips back. The weight's quite far forwards, the knees are quite bent, so the centre of mass is more over the front of the foot. So maybe draw a little line here. The centre of mass is travelling more over the front of the body, and especially with that big torso lean as well. It's meaning that it's very tricky for him not to fall forwards. Whereas what we would maybe get him to do is to just shift the hips back a little bit further, and that way he would be able to turn and accelerate in a straight line, as opposed to having to maintain his balance by stepping the foot out and then accelerating off to the side there. And we can see there as he turns, that foot, to keep balance, has to go forwards, and then obviously he's propelling himself off to the side. So now for athlete 2, this change of direction, the primary flaws probably present themselves from the side, so I'll just skip it forwards a little bit. Okay, so looking at athlete from the side, it's probably the second close turn that you can really identify it. So what's happening with the athlete here is, as he's coming close to the turn, you can see that he has a very small base of support, so his feet is very close together. So here we can see, so he has a very, very small base of support, then feet are very, very close together, which is going to mean that it's going to be very hard to get the centre of mass over that small base of support. And from here what we can also see is that knee valgus occurring, so that knee dumping on the inside there, and also the quite excessive torso dumping and a little bit of maybe torso and arm rotation happening, which is going to sway him in this direction as opposed to where we want to be going, which is to re-acceleration back in the opposite direction. So ultimately with this knee valgus, the issue is going to be that lack of limb alignment is going to mean that the push off of that back leg is ultimately going to be not so strong. Okay, so we can see as the athlete goes for that push off, there's a big sway, realigns, gets his balance, and then he's able to just push off that last little bit. Okay, whereas if the athlete was able to align that limb without it going into the valgus there, and take a slightly wider base of support, keep a little bit more stiffness in the trunk, then that acceleration will be much quicker and you get a much stronger, more explosive push off that back leg. To round up for change direction, the primary flaw was not opening the hips during the turn and re-acceleration phase. Factors influencing it were limb placement control, foot placement, and rate of force production. What this caused was projection to the side during the re-acceleration, thus increased distance and slower speed to complete the task. To assess this, we look at the hip hinge, we look at single leg strength, we look at explosive lateral strength, and we'd also look at breaking down the complexity of the drill if the athlete is able to do the following 3. In terms of programming, we'd look at practicing cueing the hips back and also following a line. For athlete 2, the primary flaw was hip internal rotation, knee valgus, paired with a nice torso dump. The factors influencing this were limb placement control and posture, and this was displayed as the hip internally rotating, the torso dumping, and this caused limited balance and a weak push off into the re-acceleration phase. To assess this, we look at hip abduction, which was okay, so we looked at hip explosive single leg strength, and also some stability with bands as a feedback. From there, we look at breaking down the complexity of the drill. And in terms of programming, we'll be heavily working on cueing the athlete to work on having a wider base during his turn, and also improving his structurability and stiffness as he focuses on the turn. In summary, from this experience in the context of the 2 athletes shown, practice of the skills are closely related derivatives with good coaching cues and specific drills selected to fit the flaws will be most effective to improve acceleration and change of direction. This is due to the majority of the flaws presented being limited due to factors influenced more heavily, in my opinion, by skill, such as limb placement, posture, and foot placement. The few capacity factors suggested, such as tissue elasticity and muscle fiber type, would likely be improved with practice of these two movements, as both athletes have limited recent experience here. Improving capacities like relative strength may also lead to some improvements and reduced injury risks down the line as a secondary or tertiary transfer of training.